Hello everyone, and a warm welcome to our Facebook Live virtual event, Empowering Pregnancy, Birth and Beyond. My name is Bridget Marr and I'll be your host for today's event, organised jointly by Mount Alvernia Hospital and sponsored by Abbott Nutrition. Initially, I would just like to introduce you to our expert speakers who we have with us today. And also to say that I think we're lucky that we have these events online in the current situation, that we can still meet up and offer support to parents-to-be. So initially I'll introduce you to Dr. Chua Yang, who is the Director and Specialist Obstetrician and Gynaecologist at a clinic for women at Mount Alvernia Hospital. Her clinic's mission is to help women achieve and maintain good health, as well as to motivate and empower women to strive for their own and their loved ones' wellness. And Dr. Chua is a firm believer in a holistic approach to health. She's also involved with non-profit organisations and is a founding director and a head of Women's Health for Global Clinic, which provides healthcare services in remote areas around the world, and also sits on the board of directors for Babes, which is a local charity who support teenage mothers through their pregnancy. Following on, I'm delighted to introduce you to Jacqueline Lowe. Jacqueline is a clinical dietitian here at Mount Alvernia Hospital. She obtained her Masters of Nutrition and Dietetics in Perth, Western Australia. She's been at Mount Alvernia for 2 years, and prior to that was working at SGH. And during her time at Mount Alvernia, she's very much enjoyed supporting the hands-on weaning workshops and also antenatal nutrition classes. And she is also mother to a bubbly 1-year-old.
Hi.
So we'd like to invite you to post questions via the Facebook page, starting off with perhaps early pregnancy or pre-pregnancy, the first trimester, and then following on through the second and third trimester. And we'll pose the questions to our experts. So just while we're waiting for all of you to post some questions, perhaps I can start off with Dr. Chua. When should I see a obstetrician gynaecologist when I discover that I'm pregnant? When should I make my first appointment?
Well, I think the first thing that I would like to remind all mummies is that the urine pregnancy kits are actually quite sensitive these days. So I've had patients who admitted to doing like 5-6 urine tests in a row because they can't believe that they are pregnant. But once the test is positive, it's quite certain that there is a pregnancy. That's very, very likely. Start calling your gynecologist. It's good if you already have a pre-existing gynecologist that you're familiar with, that has been looking after your wellness for some time. That would be the person to call and set up. I mean, sometimes appointments don't come immediately anyways, but a good time to do the first ultrasound scan probably would be around 6-7 weeks into the pregnancy. And when I say 6-7 weeks, it's with regards to, it's calculated from the first day of the last menstrual period. So given that you have about a monthly cycle, 6-7 weeks from the last menses would be the time that we expect to see something on the ultrasound scan. Baby might start to show up and we are able to give you a thumbs up about the pregnancy. It is good to have that early pregnancy scan to ascertain the dates, because not everybody has a 28-day cycle. And also, we would like to know that this pregnancy is inside the uterus, so it's in utero and it's not an ectopic pregnancy. The best time to tell you about whether there is multiple pregnancy, like twins or triplets, would also be at that time. We can diagnose whether it's a identical twin or non-identical twin fairly early in the pregnancy. So that would be a good time to get all that very important and useful information.
Mm-hmm. So don't delay is the take-home message there.
No, don't delay.
And Jacqueline, can I check with you, are there any supplements, vitamins, or that should be taken whilst you're planning a pregnancy and an early pregnancy?
Yeah, so we all know that folic acid is a very special vitamin, and it actually helps the body to produce blood. And we know that's important during pregnancy for both mommy and baby as well. So of course, you can get your folic acid from things like green leafy vegetables, cruciferous vegetables, for example, things like broccoli, cabbage, cauliflower as well. Or you can take a supplement with folic acid as well to help reduce developmental defects of the brain and spinal cord. So because the spinal cord, the neural cord forms very early on in pregnancy, it is important to take while you are actually family planning and not when you've actually found out that you've already gotten pregnant.
So any woman who could potentially become pregnant should be taking, you recommend them to take folic acid supplement?
Yeah, that's right.
Okay.
Can I just add something? I know that a lot of mummies are eager to start the pregnancy right. So I've had patients before coming to the clinic for the first time already on a whole bunch of supplements. I agree with Jacqueline. The most important thing is folic acid, and we strongly recommend that mothers take them even as they are trying to conceive. But it is not useful, and some already buy up the whole pharmacy once you get a positive test. There are some supplements we don't start till later.
Mm-hmm. And so we have a question just come in for Dr. Chua. Should I be concerned that I cannot keep food down the whole day?
I'm sorry? Could you repeat that?
Should I be concerned that I cannot keep any food down for the whole day?
Yeah, so that's a very common problem in the first trimester. Lots of mummies do struggle with morning sickness or hyperemesis gravidarum. When the morning sickness is fairly manageable, that means that yes, there's occasional throwing up, but on and off through bits of the day, you are able to hold down food. And that's a totally acceptable situation. A lot of mothers do lose a little bit of weight in the first trimester just because the appetite is bad, they feel queasy, they're not eating as much. But a small amount of weight loss, like 1-2 kilograms, is very acceptable. I always encourage my mummies to say that, take it as a weight loss program that they've been unsuccessful for some time. So it's quite okay to lose a little bit of weight, but the most important thing is not to get dehydrated. So if you're throwing up all of the time, whatever you take comes right out, whether it's food or water, any sort of juice, or even licking an ice cream, and it will just come straight out. Consider coming to the clinic because then we can put up an IV drip. We can also just sort of give you medication through the IV so that you stop that vomiting. Because there's no point giving you an oral medication or trying an oral medication and antiemetics and throwing that out straight away either. The medication won't work. So an IV would be a lot better for that purpose.
Thank you, Dr. Chua. And a question for Jacqueline. Should I be eating for two while I'm pregnant?
Should I be eating for two?
Do I need to eat?
We also get that question a lot. Okay, so when you are pregnant, I think a misconception is that you should be eating two in terms of eating double the amount, but that may not necessarily be true. So the requirements for a pregnant mummy, it only increases within the second and third trimester. And the amount of calories that it goes up by is actually only about 300 to 450 calories more. We're actually trying to focus more so on the nutrients, not so much the calories as per se. And when you're thinking about 300 to 450 calories more, it's probably just like an additional full sandwich that you'd probably be taking in. So we used to advise mummies that calcium, iron, omega-3, these are the main nutrients that you want to bulk up on. So for calcium, you'd be looking at putting in more dairy into your diet, probably adding more cheese or yogurt into snacks over the day. For iron, we'd really be looking at making sure that you're getting good sources of either red meat or darker parts of meat, for example, darker parts of chicken, or to get your iron requirements. And for omega-3, we're looking at a good, healthy, oily fish supplementation. Or if, let's say, you are vegetarian, then either plant supplementation or things like flaxseed to supplement that omega-3.
Thank you. Thank you, Jacqueline. For Dr. Chua, what is the recommended amount of weight gain during pregnancy? What is the range that would be considered ideal for pregnancy?
Yeah, as Jacqueline mentioned, more of the weight gain comes actually in the second and third trimester, not so necessary in the first trimester. And the amount of weight gain is relative also to what's the starting weight and where that mummy is on the BMI. So if the mummy is in an ideal weight before the pregnancy, sort of within the correct BMI to start with, then we're hoping that they put on about 12 kilograms on average through the whole pregnancy. And a lot of that weight gain is actually in the third trimester, and that already accounts for a fair amount of, a moderate amount of water retention, for example, which also is quite heavy. Yeah, so 12 kilograms is actually quite easy to gain through a pregnancy. So they shouldn't gain in a hurry, even in the first trimester or the second trimester. Now, usually most gynaes might see their patients about on a monthly basis. And so for the first 6-7 months, usually every month they can gain maybe about a kilo, at most 1.5 kilos. But beyond that, in the third trimester, most mummies do gain up to about 2 kilograms each month. If you start the pregnancy underweight, we do expect you to gain a little bit more. So maybe up to about 15 kilos or so, depending on how underweight you are. Basically, once the mother stops sort of skipping meals, packing on food, they are concerned about the pregnancy, they are eating more on time, they're eating nutritiously, they're basically putting back weight that they should have had in the first place. That's the whole point. And then there's a lot of mothers who are overweight before the pregnancy. Once they start to be careful about the eating, that they're noticing their nutritional value rather than just eating empty calories, naturally they will stop that rapid weight gain. So they will be expected to gain slightly less than the 12 kilograms. So it all depends on what they start with, their pre-existing condition, whether they already perhaps have pre-existing diabetes, for example. That would be a different story. So we're talking about the general mother.
Thank you. So just to ask to Jacqueline a question. What if I have strong food cravings? How can I have a balanced diet?
Yeah, so the cravings do come on, especially within the second and third trimester. Once I think mummies get over that first trimester where they're always feeling a little bit sick and nauseated or throwing up, suddenly they get their appetite back and then everything seems wonderful again. So I think that's when the cravings and the unusual food habits maybe start to creep in. How they would curb that, unfortunately, you can't really curb the cravings as much. The cravings do come and go. And I think that's when you can actually target it. So on craving days, you can allow yourself that luxury. And I would advise against going to the supermarket on a craving day, because you bring back a whole load of maybe unhealthy foods that you shouldn't be storing at home. And then that's when the cycle continues again. So not going to the supermarket on a craving day. And then on non-craving days, that's when you can actually, try to eat as healthy as you can. So making sure that you're not going for either deep fried foods or overly sweet foods, making sure that you're getting your vitamins through your fruit and vegetables in on those days, then I would say then that's what you would do to try to curb excessive eating. Yeah.
Sounds like a good plan. So one for Dr. Chua, what role do I have as a daddy for my wife's pregnancy journey?
The daddy has a big role. Is he's supportive. So, when mummies have cravings, they have to sort of moderate those cravings, right? So a lot of time I encourage daddies to come along during the consultations as well. We really like to see daddies present right from the start of the journey. And that's also because 4 years listening to the advice is much better than 2. So they're there to remember what the doctors may have said in about eating healthy, about the do's and don'ts. So sometimes when mummies feel like, picking out a durian season, for example, daddies may remember that, hey, doctors reminded them the durians are really, really high sugar and really shouldn't be eaten too much in the pregnancy. So throughout the whole pregnancy, daddies play a very, very big role.
Thank you. So we've got a question for Jacqueline here. Can I check if we can take canned tuan or sardines? Should I be concerned about the mercury content?
Can tuna or sardines? Is that the question?
It must be tuna. Sorry, tuna.
Yeah. It's okay. Yeah. So if we're talking about locally or imported from Australia canned tuna or sardines, those ones are perfectly fine. I think the concern there is that there's mercury in the tuna that you're eating. Mm-hmm. The local brands, for example, Ayam brand, our typical Singaporean brand, that chooses tuna that isn't high in mercury, so we're okay there. You can consume that. Other overseas brands, we just have to be a little bit careful as well. So if you're looking on the back of the label, if you're looking at the ingredients panel, the main tuna that you want to be watching out for would be something called white tuna or albacore tuna. Those two tunas tend to be larger. They tend to be predatory tuna, so they do have higher levels of mercury in them.
Thank you. What was the second one you mentioned? White tuna and
albacore.
Albacore tuna.
So white tuna would be a different name for the albacore or big eye tuna.
Mm-hmm. Thank you. So there's a question here for Dr. Chua. When can I start exercising during pregnancy, and any types of exercise that I should avoid?
So I normally don't encourage a whole bunch of exercises in the first trimester. There's a lot of adjustments that the mummy is going through throughout the first trimester. Usually there's a physiological drop in the blood pressure. So most mothers at the start of the pregnancy will feel quite tired and ready for bed at any point in time in the day. So it's important to sort of roll with that. Make sure that they hydrate whenever possible, eat a little bit if they can, but rest plenty. And it's very important also not to exert, not to carry heavy loads, not to carry heavy things. But once the energy level starts to get better, the food intake is a lot more regular in the second trimester, they can definitely step up and start back on their exercises. I normally recommend that they exercise within their limits, which means that they're only doing things that they have already always been comfortable doing, but reduce a little bit of intensity. So I've got mothers who normally run marathons, and they would still be running 5-10 clicks a day, and that would be an easy peasy run for them. So that's okay. If you're normally just a 5-click treadmill jogger, then maybe just brisk walk. If you normally brisk walk, maybe just walk. So always lower the intensity. Imagine that while you're exercising, whatever the exercise may be, that you are able to chit chat with somebody at the side. So you are never quite out of breath. So you can carry on in that fashion. Weightlifting, straining exercises are to be avoided during the pregnancy. And if it's a new exercise, if you suddenly feel like you want to do yoga or Pilates, please join the antenatal classes. Do it under supervision, not just YouTube something.
Yes, some very clear and reassuring advice there. So, Jacqueline, for you, are there any foods that I should avoid as a pregnant mummy? Are there any foods that really should be off limits and avoided during the pregnancy?
Yeah, so with foods that you should be avoiding, because the immune system of a pregnant mummy is weaker, it's important to avoid foods that have higher rates of bacteria contamination. So things like your meats, whichever meat that might be, so chicken, fish, pork, and all seafood should be fully cooked before you take it. And also you should be taking precaution with how the food is stored or prepared. So you probably want to go for things that you're more comfortable with. Maybe, avoiding street food, things like that would be beneficial. And then again with cheeses, so soft cheeses, for example, whether it's blue cheese or cheese that has been with mold on it, things like brie, camembert, you'd be a little bit more careful with those. You would try to avoid them as much as possible. And then we focused on high mercury fish such as the tuna earlier on. There are other high mercury fish that you should be avoiding during this time as well. So that would involve shark, swordfish, and king mackerel as well. Alcohol during this time should be avoided as well. With regards to caffeine, though, caffeine can be taken in small quantities. So the recommendation is actually about 200 milligrams a day, which is roughly about a cup of coffee or two cups of tea over the day. So also with caffeine, it depends on how you brew it as well. So our hawker center coffees generally tend to have a little bit more caffeine because they've been percolated, they've been steeped for longer. They tend to be a little bit thicker as well. So the caffeine content in those kinds of coffees tend to be a little bit higher as well. So just something to note.
Jacqueline, can I ask you? But there is caffeine in a lot of other foods, though, that people don't remember that it's already there. So the coffee really adds on.
It does.
Yeah, so I do remind mummies that any sort of canned drinks, packet drinks will have caffeine. Tea has caffeine. Green tea has caffeine. Chocolates have caffeine. Yeah, so it rapidly adds up to that 200 grams. Yeah.
Yeah, you're right.
So we have a question here for Dr. Chua. Is there any way to help with insomnia?
That's a tough one. It depends on what the insomnia might be due to. There are some mothers with the hormonal change are just really super alert and will for a little while have that adrenaline pump type sort of behavior going. And they may be excited about the pregnancy to start with. It may have been a long awaited for baby. Sometimes they're worried if they've had bad outcomes in previous pregnancies before. A lot of times they worry till it passes that at-risk period. Sometimes it is just because they have to get up to pee. So, in a lot of the early pregnancy, while the whole pregnancy is still in the pelvis, the rapidly growing uterus is really giving pressures on the bladder. So it's common to have that feeling like you need to pee all the time. So it's important that you recognize what may be the reason and perhaps then deal with those factors.
Thank you. So for Jacqueline, what is the role of a maternal nutritional supplement and how do they help during pregnancy?
Yeah, so the nutritional supplements, the multivitamins rather, they definitely do safeguard the pregnancy. So usually they would have high levels of that folic acid and iron as well, which is important in producing blood for the mummy and the baby as well. And this, of course, supports pregnancy throughout all the trimesters. So it is important to take, and it is usually prescribed by the doctor.
Thank you. So for Dr. Chua, what should I do if my baby is sitting on my bladder?
That's a tough one. Like I said, in the first trimester, the entire womb is increasing in size and it's still within the pelvis. So it's definitely giving pressures to the bladder. But towards the end, in the last trimester, the head also goes down into the pelvis and also presses on the bladder. So that increasing size is something that is physiological and we can't really change that. But it is important to not let that feeling make you drink less, because hydration is really, really key in helping the baby grow. All the baby gets is through circulation. So if a mother gets dehydrated because she's scared of filling the bladder, feeling like she needs to pee all the time, don't want her colleagues to sort of glare at her for going to the toilet too often, she may underhydrate, and that's not a good thing during pregnancy. So just drink frequently, little sips at a time, so that it doesn't get, don't get thirsty and drink one whole gulp and then end up feeling the need to pee already. Little sips along the way helps to retain water. So that's a better way to drink. And just go more frequently until that pressure lifts off. Yeah, that's nothing to be worried about. That's a normal thing.
So another one for Jacqueline. Is it safe to take kefir milk too?
Yeah.
Milk?
So kefir, so that's a probiotic as well, and it can be safe to take during pregnancy. But I understand that nowadays a lot of people like to do kefir at home, where they're doing it, you're fermenting it yourself. So in that sense, you're taking on a little bit of risk as well. Usually I would recommend a store-bought one where it has been pasteurized, just to eliminate that risk. So kefir can be safe, but you would have to buy it in a store.
Mm-hmm. So to eliminate any risk of food poisoning.
That's right. So you'd be looking for a pasteurized version of kefir milk.
Okay, thank you. So we've got one that was covered, I think, earlier, but it looks like it's an important question. Dr. Chua, I just used a pregnancy test kit and it's positive. My pregnancy is about 4 weeks, 5 days now. Should I go to the clinic to confirm, or can I wait until week 6 or 7?
Well, if the menstrual cycle has been quite regular and it's been, the last menses behavior was very typical and you're fairly certain about the dates, then at 4.5 weeks, we may not be able to detect the pregnancy on ultrasound scan just yet. A urine pregnancy test that is positive is already a good start. If there's no bleeding issue, there's no spotting, staining, start taking the folic acid if you're not already on one. Start to make an appointment to see the doctor. Probably about a week and a half later would be the great time for that first appointment. So at 6 weeks.
So we thank you. So we have one for both of you here. How limited must activity? Well, one for Dr. Chua, I guess initially. How limited must activity be after threatened preterm labour, balancing with the background of gestational diabetes?
Well, I've always counseled that eating right is still the bottom line for control of weights, for control of sugars, whether you're pregnant or not. We shouldn't count on exercise to help lose weight or to help control diabetes. Because even for very regularly exercising people, there are still situations where the exercise program needs to be halted or paused. For example, bad weather, injuries, illnesses, that sort of thing. So learning to eat right is still the first thing that needs to be done. So if there is a high-risk pregnancy, whether it is preterm labor, whether it is an incompetent cervix, whether it's a low-lying placenta previa situation, high blood pressure, so on and so forth, it is important to then slow down all the activities. That doesn't mean that a mummy needs to completely lie in bed. Of course, that depends on the situation, and some mummies may need to do that. But in general, then sort of slowing it down, just strolling would be plenty, would be enough. There shouldn't be an organized exercise. There should be nothing that is straining at all.
And to add on from that, I guess from the diet,
and
gestational diabetes, I think she asked if there should be a cut in calories if exercise is limited. So for gestational diabetes mummies, the minimum we would go to anyway is 1,800 calories. So we're still aiming for a good distribution of carbohydrates. We're still aiming for good sources of protein and vegetables as well. We're not really looking at cutting your calories at this point in time because all of those are important nutrients during the whole pregnancy, and they're going to be supporting you after birth as well. So we're not really looking at a diet plan as per se. It's more so making sure that excessive loads of carbohydrates are being controlled. First of all, we're not choosing carbohydrates that are simple carbohydrates, so nothing that's going to spike your blood sugars. Things like fruit juices, things like milkshakes or desserts. We're cutting those out as well, but not your main nutrients.
So thank you. So one for Dr. Chua. Do mummies always have to sleep, pregnant mummies always have to sleep on their left side? Any major issues to sleep on the right or on your back?
So that's only an important thing in the third trimester from 28 weeks onwards. So it doesn't need to be so in the early part of the pregnancy. And the reason for needing that in the third trimester is because the weight of the pregnancy, the baby, the water inside the uterus, it's all getting very heavy. So if you're lying on your back, what's happening is that the uterus with all that weight is pressing down on mummy's own blood pressure, the big blood vessel, which is the aorta, and the IVC, the inferior vena cava. On the left is better than right because on the left we have the aorta, which is more tenacious and doesn't get compressed as much as the IVC, which is a little bit more pliable. So if you sleep on the right, the inferior vena cava can get compressed, and so blood returning back to the heart may have problems. And that means that there may be more water retention, that sort of thing. So it is good to try to ease into that habit. So for mothers who do not have a left-leaning habit, it's good to use the first and second trimester to sort of, in a very stressless way, try to get into the habit. But there's no need to sort of fuss about it all that much. Yeah. And mind you, it's not necessary to lie at 90 degrees to the side. Otherwise, an entire arm would be numb, and then there would be a lot of discomfort. So a slight tilt would do, a little pillow right at the back to sort of prevent flopping back to on your back. That would suffice.
Thank you. That sounds like good advice to start practicing early on.
Yeah.
So for Jacqueline, what about cooking with cooking wine or mirin with some alcohol content?
Yeah. So although alcohol is something that we should be avoiding during our pregnancy, cooking wine and mirin can still be taken as long as the alcohol has actually been cooked off. So any cooking method that you would do, you would typically put the cooking wine in first or the mirin in first. You wouldn't be putting it right at the end of the cooking session where the cooking alcohol may still actually be in the stew or in the broth that you're making. You want that alcohol content to be fully evaporated.
Thank you. So we've got a question for Dr. Chua. I am worried that my baby may not be healthy. What can I do? Is there any type of screening checks that can detect any health conditions of my baby? Should I go for screening in my first or second trimester? Well,
in Singapore, I must say that our antenatal care is really, really top ranking in the world. And that's because very, very rarely do we get mothers who are not booked even in the first trimester. And most mothers in Singapore have antenatal care of some sort fairly early. And that means that all the essential screenings and the standard of care is fairly strictly adhered to. From the get-go, we are making sure that this pregnancy is in the uterus. We are making sure that we are seeing baby's size, shape, the two arms, the two legs. We are screening each time that we do an ultrasound scan. So even in the restructured hospital, in the government subsidized care, a very minimum sort of screening program would involve an early trimester screen. That may or may not include chromosome screening. It will also include a second trimester 20-week detailed ultrasound scan looking for structural abnormality, and then often in the third trimester looking for growth or any reduction in growth or excessive growth. So even in the restructured care, mothers do get very good antenatal care. In private service, we are scanning mummies pretty much each visit that they come. I mean, for me, it is one way to ensure that we constantly check on the baby and to ensure that we have another point of view to make sure that we don't miss things. But more importantly, just because most pregnancies are without abnormalities, more importantly, mummies and daddies get to see their babies, and it starts the bonding right from the get-go. And they can see what baby is doing, how active the baby is, whether they're sucking the little thumb, or the personality already shows sometimes even on the ultrasound scan. So it really enhances bonding, I feel.
Mm-hmm. So reassuring. So for Jacqueline, so we have a question here. May I ask how vegetarian mummies can obtain enough nutrients during pregnancy and breastfeeding?
Yeah, so moms who are vegetarian can definitely provide equal nutrition for their babies as well, but we just do need to ensure that certain nutrients that tend to be more abundant in animal proteins aren't missed out as well. So this would be things like vitamin B12, vitamin D, calcium, protein, and iron amongst some of these important vitamins. So for vegetarian mummy to also eat eggs and drink or take dairy products, this would be primarily grains, cheese, dairy, eggs, and non-heme iron sources as well. So non-heme just means that it doesn't come from red meat. It doesn't come from an animal source. So non-heme iron sources are things like spinach, broccoli, as well as your beans. And those unfortunately aren't as well absorbed by the body. But if you combine that with a vitamin C containing food, for example, fruit, let's say an iron fortified cereal plus a fruit on top of that, like an orange, then you'd be able to enhance the bioavailability of this non-heme iron. For mummies who are actually vegan, on the other hand, it probably does require a little bit of supplementation, especially from the vitamin D and calcium point of things. But definitely they can provide as good nutrition to their babies.
Thank you.
May I add something about the iron supplementation? A lot of mummies think that if they start off with an iron hemoglobin level that is fairly normal, that they do not need supplementation. I usually do encourage them to also still have a supplement because we're anticipating blood loss at the end of the pregnancy at the delivery. So at most deliveries, whether it's a vaginal birth or a cesarean section, most mothers will lose about 300-400 mils of blood, and that's quite standard amount of blood that is lost. If you go for a blood donation drive and they stringe out that packet of blood from you for donation, that packet is about 200 mils. So you can see that 2 packs of blood are just sort of like lost from you through that delivery process. So I usually do like to pump up the hemoglobin slightly through the pregnancy, even if your startup is quite normal. And I find that for mothers who become anemic post-delivery, it usually can affect their breast milk supply. It usually can affect their moods as well. They get more likely to develop postnatal blues, just because they feel more tired. So it is a good thing to supplement iron through the pregnancy, regardless of the starting level.
So top up those iron stores.
Yeah.
So we have a question for Dr. Chua. Is a water birth safe?
Is the water birth safe? It is in a specific water birthing center. I think in Singapore, the uptake for water birth is still relatively low. So we don't have a very focused water birthing center which does nothing but water births. And unlike many places, let's say in the States or in Australia, perhaps, if you have a birthing center that does nothing but water births and all the staff and the nurses and the midwives are tuned to water birth and how important it is to keep that water clean so that the baby is not sucking in water that is soiled with your pee or poop, to be able to drain that water fast enough, and the setup is really spot on, then that is a very safe water birthing center. But perhaps that is really quite hard to manage in most hospitals' standard setups in Singapore. So therefore, in our local context, it may not be the safest option.
Thank you. So we have one for Jacqueline. Would you recommend taking a maternal milk? At what point, perhaps for which group would you in the pregnancy or until after pregnancy?
Mm-hmm. As a dietitian, I always prefer taking natural foods. So things like to get your vitamins, I would still recommend going for whole sources of whole grains, vegetables, protein. Of course, maternal milk do have its role, especially during the first trimester. If let's say you're still having quite a bit of nausea, or like the previous lady mentioned, she was vomiting out quite a bit, she wasn't able to keep her food down, then in that sense, the maternal milk would be a good supplement to take during that time. But I think if you have a good appetite, you're craving foods, go for the foods as opposed to the maternal milk. I think it would be a little bit more satisfying as well in terms of, mouthfeel, satisfying your cravings. And how long you would take the maternal milk until, it really depends on pregnancy to pregnancy. So if let's say for some moms, they experience that poor appetite because let's say within the third trimester, baby's getting a little bit bigger, resting on the tummy, you're feeling very uncomfortable, your appetite is not as good because there's a little bit of reflux as well, then in that sense, maternal milk also has its role there. So it does depend on each individual mummy and how long you take the maternal milk for. Really after pregnancy, I would probably say that's not necessary. I think by then you would be back to normal. You would be having your full meals, regular meals. So in that sense, maternal milk wouldn't be for post-pregnancy.
Mm-hmm. So very much depends on the individual person.
Yeah.
So for Dr. Chua, my doctor recommends a natural birth, but I prefer a C-section. What are your thoughts?
Well, I think it is important to recognize that there are many situations where natural birth may not apply. Then that's a totally different situation. If the doctor has already recommended natural birth, I'm assuming that there are no contraindications to the natural birth, and it's only down to a choice. Now, in the long and short term, natural birth results in the least amount of complications. So we're not usually talking about just how easy that birthing experience is for the first time, especially this is the first pregnancy. What I normally explain to mummies is that the first pregnancy, if you do a cesarean section, that cesarean section is likely to be quite easy because it's what we call a virgin abdomen. The tummy has not been cut into before, right? So there are no scars inside, there are no adhesions, it's quite clean. But it's the future that starts to become more complicated. So the future surgeries, whether it's a repeat cesarean section or any other types of abdominal surgery that you may need in the future, those may be complicated by this decision to have done that cesarean section. The next pregnancy, there is higher risk of placenta being adhered to that scar. There's higher risk of scar rupture. There's a higher risk of pregnancies that may be implanted on the scar, a scar pregnancy, and those are all potentially life-threatening scenarios. And so those situations would not exist if you had done the vaginal birth for the first time. And if the first pregnancy is successfully delivered vaginally, the next pregnancy is going to be, the next delivery is going to be so much easier. We usually say that the first labor is a painful 10-12 hours of wait, right? So that's quite an average time frame. But then the second one is going to be 5-6 hours. The third one is going to be 2-3 hours. It half each of that time. So it's the future that gets brighter and easier and less complicated if an uncomplicated, successful vaginal birth is done. the first time. So don't just think short term, don't just think of maybe enduring pains or maybe the unknown or maybe I don't know how long we have to wait, through labor. Don't think of short term things like that. Think about the long term well-being of the mother and the baby.
Thank you. So for Jacqueline, does food affect the amount, quality, or nutritional value of my breast milk?
Yeah, I think the phrase "you are what you eat" is probably very applicable here. Breast milk is definitely, it would be the main source of nutrition for your baby straight out. So the mummy's nutrition, all of that goes into the breast milk as well. And that's what your baby is going to be taking for the next maybe six months of the baby's life. So what you eat definitely does affect, and you can aid the production of breast milk as well. So there are things called galactagogues, certain foods that actually help breast milk production. But I will say that it must be used together with efficient and regular clearing of the breast milk as well. I think there's a misconception there that, by taking these, whether it be fenugreek or fennel or milk thistle or brewer's yeast even, by taking these things to help the breast milk, it's just going to magically come. But it does need to be used in conjunction with regular breastfeeding as well. And I think one thing that's very common nowadays is the use of lactation cookies. So lactation cookies can be like a combination of these galactagogues inside like an oatmeal biscuit or something like that. And balancing the appropriate dosage of those items inside a cookie, so making sure that the taste is good and the texture is right, can be a little bit difficult once you're looking at how much you need of those particular galactagogues to make your breast milk supply go up. So you might not always be getting the full benefit with a lactation cookie. So it's still important to actually continue to breastfeed, have a good balanced diet on top of all those things.
Thank you. So for Dr. Chua, is it recommended that my doctor for delivery should be the same doctor that I visit during my pregnancy journey? Or is it fine that a different doctor helps with the birth?
Well, it benefits you if you're seeing the familiar face at the delivery. At the delivery, it's a little bit of a high stress situation for most mothers. This is the climax of the whole 40-week journey, and you're about to see baby. You really don't want anything to go wrong. So there's a certain amount of anxiety and stress. It is a very reassuring thing to see the face of somebody who has been advising you and counseling you throughout this journey come and be by your side during this delivery process. However, this is a very unusual year, but obstetricians don't work 365 days of the week. So there are occasions where your personal gynae may not be available at the time of your delivery. And sometimes they may be sick or they have personal issues at home that they have to attend to, and they just really can't come. But I think there's a certain amount of trust that most gynaes really want the best for their patients. So if I'm not there and I'm really not able to be at the delivery, I usually would make sure that my patients are very well looked after by colleagues that I absolutely trust, who I will know that these are doctors who have pretty much the same point of view as I do and will manage the patient fairly similarly as I will. So we do match ourselves when we find doctors to cover us when we are on leave or when we are unable to come. So our patients don't feel so blindsided by somebody entirely with a different vibe in that sense. Yeah, so preferably yes, the same doctor.
Thank you. So we have one following on from the lactation cookies for Jacqueline. My older child loves to nibble on my lactation cookies. Should I be worried?
I guess it depends on how old the child is, but there usually isn't dangerous amounts of those items inside that cookie, I think the more concerning bit would be, is there too much sugar inside that lactation cookie? Other than that, I don't think there's any main concern. It's just the sugar amount may be a little bit excessive. It depends on how much he's eating as well. So you'd probably want to put the lactation cookies on a higher shelf.
For Dr. Chua, is it true that my baby will have a healthier gut if fed on breast milk, if breastfed? Can this be compensated as they grow?
Well, we support lactation, we support breastfeeding as always the first choice if we can. It's sometimes sad that not every single mother can completely fully breastfeed their babies, but whenever they can, they should always try as a start. For the first 6 months of life, breast milk is adequate for growth, and breast milk brings about all the goodness that formula sometimes cannot provide. So, for example, the antibodies, and that's important. Now, where the mothers are concerned, hopefully they are in a good position. They are feeling good. They're eating healthy, and therefore the breast milk carries every single thing that the formulas will be able to sort of balance out and already provide as a standard issue. But some mothers may not be eating well at that time, particularly if they have postnatal depression or postnatal blues, or they're not rested and they're not sleeping. So it is very individualized. What is very important is to take the lead of the lactation consultants, to take the lead of the gynaecologist, to take the lead of the pediatricians. If we sense that the baby is underperforming, is in terms of weight gain, perhaps in terms of pee and poop, in terms of maybe rapidly rising jaundice levels, sometimes the pediatricians will actively suggest to supplement a little bit with formula because the mother may not be providing adequately at the start. So we don't want the babies to get dehydrated. I want to remind mothers that it's, with this child, it's a lifelong journey of eating right and healthy living. And it's very important that they remember through life not to feed this child junk food and bring to fast food and eat a lot of, potato chips and sugars and sweets and stuff like that. If you can do that lifelong, it's so much more meaningful than, let's say, to underhydrate the baby right at the beginning because you just want to completely breastfeed. So, I always remind mothers to think, the entire life journey rather than right now. And that's very important. Whenever possible, we do support them in terms of breastfeeding. And remember that the hospital has got lactation consultants that they can refer back to after the delivery. They can call us, they can make appointments to see us to get the most specific individualized advice that they need.
Thank you. So one for Jacqueline. Is pesto pasta, guacamole, these are very specific, and chicken essence safe for consumption during pregnancy?
The three that they mentioned, the pesto pasta, guacamole, and chicken essence, yeah, those are fine. They're pretty much fully cooked. The guacamole, I guess it depends where that guacamole comes from, but most homemade guacamoles are fine. Chicken essence usually comes in a pre-packed little jar, so that's fine as well. Those are safe.
Okay, I think we've maybe covered this before, but I think it's an important one for Dr. Chua. Is the activity limit for threatened preterm labour until 37 weeks, or all the way at least 39 weeks? So this mummy sounds like she's having a really hard time not exercising and going out for slightly longer.
Well, the concept of prematurity is until 34 weeks of the pregnancy. So before 34 weeks, the baby is considered premature. And that means that the organ system may not be functionally ready for life as its best. Passing 34 weeks, lungs are mature. So babies that come out between 34 weeks and 37 weeks are considered preterm rather than premature. And they perform reasonably well, especially if there were sort of preventive measures taken before the baby arrived. Passing 37 weeks, we have a completely full-term babies, and they usually do just fine. So if there is a high risk for premature delivery for this mother, perhaps because of previous experiences, or there's constantly shortening of the cervix, or she's staining, or she has broken water early and is buying time, then we are talking about a bed rest situation until 37 weeks. Beyond 37 weeks, baby is welcome to arrive. So we don't go all out to stop that labor anymore. Yeah.
Thank you. So we have one for Jacqueline. We have a mummy who's sensitive to lactose, can't take large amounts of milk and yogurt. How would she get enough calcium in her diet?
Yeah. So there are different sources of dairy products that are low in lactose. It depends how sensitive to lactose you are as well. So some mummies will still be able to take small amounts of milk, so probably not one glass at one shot, but maybe half a glass spread out over the day. If, let's say, you are very sensitive to lactose, there are lactose-free versions as well in the supermarket. They're quite readily available. You can opt for those. If not, then you can go for things like fortified soy milks. So not the soy milk that you get in the hawker centers or at specialty shops. They do have to say calcium fortified on the packet itself. And we do have a few brands that are available in the supermarkets for those. Other than that, cheese, so like sliced cheese, those are fairly low lactose, and those do contain quite a bit of calcium, so you can get your sources from there. If not, small fish, for example, ikan bilis also contain quite a bit of calcium, so you can get your calcium from there as well.
Thank you. So another one for Dr. Chua. Another specific one here. Will pregnant mum's blood pressure be slightly lower during the course of pregnancy? What would be a safe range, and anything to worry about if it's lower?
So blood pressures are usually physiologically lower in the first trimester. Once the hormones change, the blood vessels will dilate, but the blood volume hasn't caught up. So you and I will have 5 liters of blood circulating, but the mother is generating an extra liter. But that takes the whole first trimester to sort of put in place. In the first trimester, that's why mothers tend to feel very tired. It is compounded by the fact that they may not be eating and drinking well because they may have morning sickness, they may be throwing up. So the relative dehydration will further lower that blood pressure. So that's why it's very important to hydrate throughout the day if possible. That means little sips, just bite-sized food, 1 sip of water every few minutes, half an hourly, 1 hourly, just to get the water content in. That will help to maintain the blood pressure. It is very important when the blood pressure is slightly lower that they don't go out and try to do exercises. You're tired because of the low blood pressure, not because you've stopped exercising. And it's also very important to be aware that getting up too quickly from a lying down or sitting position may then make that mother feel suddenly sort of lightheaded. So slow things down a little bit, give yourself plenty of time to move from point A to point B rather than rush. So that's very important. Come second trimester, most blood pressures have normalized. And in fact, in the third trimester, there is a worrying condition called preeclampsia, where blood pressure may in fact pathologically start to rise to be out of control. So the regular checks with the doctors are helping to monitor these things. Every time that the patient comes to the clinic, we are measuring their blood pressure. We're checking on their urine samples as well to make sure that they don't have this condition called preeclampsia. And that's the purpose of doing all those checks. They are not for fun, for the mummy to pee into the stick. It's not something that's for fun. It's a very useful test actually to make sure that we're not dealing with something like preeclampsia.
So yeah, very, very important to exclude. So for Jacqueline, can I drink bottled bird's nest with collagen every day during pregnancy or breastfeeding? I've heard stories of babies being born with asthma due to consuming bird's nest.
Yeah, with any of these kinds of, I guess, more traditional Chinese medicines, as well as any kind of herbal teas, I wouldn't suggest daily consumption of them. For bird's nest, I'd probably suggest a few times a week or once a week, if anything. Any of these kinds of birds. For asthma, with regards to asthma, I haven't really heard of bird's nest causing asthma for the baby. But either way, I would probably suggest it to be taken sparingly. So once a week.
You get asked that a lot too, Jacqueline.
Yeah.
About the bird's nest and asthma. Yeah. I am more cautious about having them take pre-packaged ones that may have tang gui and ginseng. Because tang gui and ginseng can thin blood and it may aggravate bleeding tendencies. If the mother is, let's say, on aspirin through the pregnancy already, or if there was a pre-existing bleeding tendency like a low-lying placenta or spotting through the first trimester, that's also one reason I don't tend to start fish oil in the first trimester, just to avoid excess bleeding.
So one for Dr. Chua, is there any way to encourage the baby to turn to the cephalic occiput anterior position?
Wow, so specific. Well, what we want is for baby to be head down, and 80% of pregnancies are already head down by 28 weeks. And then in the following weeks in the third trimester, more and more will start to sort of line up and start to go head down. So it's a fairly natural thing, and there's no need to worry if you're still early in the pregnancy and the baby's in a breech position or lying sideways. It may just happen naturally anyways. Sometimes babies don't go head down because the head is bigger than the pelvic space. So you have to account for some pelvic sort of shapes and some narrower pelvis whereby the head cannot enter naturally. And it's nature's way of saying that, hey, the vaginal birth is not a good idea in this situation. You're not gonna make it easily, or you're not gonna make it. So then the baby persistently stays in the breech position, and we can't really want to force that scenario. But one of the things to try to encourage the baby to turn, I suppose, is perhaps worth a try at about 28 or 32 weeks if the baby is still in a head-up position, is the yoga pose downward dog. So it encourages the buttocks to lift off of the mummy's pelvis by having that pelvic tilt, by having the buttocks higher up. So once you get up, though, the head, which is the heavier and bigger portion, would naturally turn down, will naturally move down into the pelvis. So I've asked mummies to try that if they were yoga practitioners anyways, only if it is a comfortable enough thing to try at home. Yeah.
So for Jacqueline, we've got a couple of questions about soya milk and bean curd. So can mummies drink soya milk or have bean curd every day? And does drinking more soya milk or milk give a more white-skinned, fair baby?
Yeah. So I think it depends on your regular intake. So I think for vegetarian mummies who, I guess, rely on soy a lot more for their protein intake, I think that's perfectly acceptable to take soybean curd as your main protein source every day, or drink soy milk as well. I do think that it is important, especially if you are taking it for calcium supplementation. If you can take other sources as well, that would be good to alternate your calcium source or your protein source if possible. But if, let's say, that is your main source of protein or calcium, then by all means, soy milk or soybean curd is safe to take every day. With regards to the fair skin or the white skin, I think we've heard a lot of this, especially for, whether coconut water can give a cleaner baby after birth, something like that. So far, unfortunately, no concrete evidence surrounding that. So I can't give you a firm answer whether it does produce a whiter baby, unfortunately.
Mummies are telling me that coconut water will create a better skin too, or cleaner baby is the one that I've heard. which is quite interesting.
Yeah.
Yeah.
So for Dr. Chua, another question about the position of the baby. Will an anterior placenta affect the labour position?
No.
Okay.
No. The placenta could be implanted right at the top. It could be anterior, it could be posterior. It's important not to have it below. That means it's a low-lying placenta or a placenta previa where it actually blocks the birth canal. So it blocks the cervix. If it blocks the cervix, then a natural birth is out of the question and mommy will need a cesarean section. But anterior or posterior doesn't matter.
So another one for Jacqueline. May we know which food items might be milk killers or reduce breast milk production?
That's a good one.
Yeah.
With regards to milk killers, I mean, I know there are medications that will help in stopping milk production, and cabbage, in terms of food, cabbage is one of them as well. With regards to other foods, I think a lot of this is probably surrounding traditional Chinese medicine as well. So certain foods are not suitable for breastfeeding mothers. With regards to, I guess, more English medicine, I think what we're looking for is, making sure that the fluid supply, making sure that the mom is hydrated is the main key. So things that are diuretics, things that, cause a lot of, I guess, for the mummy to pass out a lot of urine. So things like coffees and teas, generally that tends to dehydrate the mother. And then in that sense, breast milk supply is also reduced, or breast milk amount is also reduced. So I would probably take it from that sense.
So for Dr. Chua, what are the signs and symptoms of postpartum depression, baby blues? What to look at?
So I normally check on the mummies, not just while they are in the ward, straight after the delivery. It usually may not show up at that time because they're resting, and we have all the very helpful and experienced nurses around them helping, and the support is so good while they're resting in the postnatal wards. But once they go home and that support system has deserted, so to speak, it really depends also on their setup at home. There are couples who may not be well supported at this time, particularly if their family members cannot travel and cannot come and be with them in the post-delivery period, and it's quite stressful. Sometimes even the confinement services are not able to come because the border closing. So this is also a very stressful situation if they are not supported. It is very important during the pregnancy for husband and wife, daddies and mummies, to already make game plans for the postnatal period of what are the tasks that needs to be done, how to divide and conquer, how the daddy is going to be there to support the mummy. And then those are really the eyes and ears to look out for any sort of subtle changes, because husbands are usually the first to notice that the wives are not behaving quite the same. I usually see postnatal patients about 1 week after their delivery in order to try to pick up these mood changes. And typically when we ask them how the babies have performed, whether there are any stresses, it is quite easy to bring that up, the mood changes, the low moods, the insecurities, the anxieties. So when we get to ask them the questions of whether they're feeling okay, whether they feel that babies are stressing them out, or whether the circumstances are stressing them. Sometimes it's not the baby, sometimes it could be the mother or the mother-in-law that's stressing them out at home. Whether there are any stress factors. Usually the mothers are fairly quick to share, and so it's a good point to sort of try to pick up postnatal blues. Mothers who get teary, who feel very insecure, who doesn't know whether she's doing the right thing or feels that she may not be doing the best for their kid, because every parent wants the best for their kids, and it's very scary to not know what that best even is. So it's important to have the support either from families, from the gynecologist, from the lactation consultant, sometimes with confinement help, that they hopefully every mother is supported in that way. And if there are very much more pathological mood changes, it may be depression or sometimes very rarely postnatal psychosis, then we really do need to refer them to even more specialized help.
Thank you. So we're nearing the end now. So I think it'll be a last question for Jacqueline. Somebody who's interested about baby-led weaning. Is that something then they're wanting to make decisions about weaning their baby?
Yeah. So with baby-led weaning, I guess nowadays baby-led weaning has become so popular, especially with the new moms. And there's always is baby-led weaning better than traditional weaning? So traditional weaning would be just starting off with purees as the first foods. And I think it really depends on the family structure, what you're able to provide for your baby. Baby-led weaning is something that I guess needs to be consistent between the caregivers. So a lot of the times, especially at 6 months of age, there will be multiple caregivers involved. So you do have to make sure that everybody's on the same page. You have to make sure that, the feeding style is the same, and the size of the food that you're going to be giving to the baby is the same as well. I know a lot of the older generation don't feel comfortable. They're very scared of choking, especially giving a baby, a fist-sized kind of piece of carrot. So I think everybody needs to be on the same page. If, let's say, family members are not so keen and there's already an apprehensive nature about it, I think it's probably better to stick to the traditional sense. And there's really there's no right or wrong way, as long as everybody's on the same page, and the outcome would be the same. We would still be weaning the baby off. The baby would still be getting the same nutrients, as long as the baby is getting, the right amount of nutrients. Either way of weaning is fine.
So just to finish, I'd just like to invite both our speakers, who I think have done a brilliant job answering all the questions, just to maybe a key takeaway message from today from both of you, just a sort of a message just to take home for our attendees. So Dr. Chua, if you'd like to go first.
Well, I think antenatal care is brilliant in Singapore because most people attend antenatal clinics. What is important, I guess, is always to cultivate a really good, strong relationship between doctor and patient, between the gynecologist and the pregnant mummies, or even the couple, to have good communications, to discuss things. Every question that you may have, you really want to discuss with the most appropriate people, whether it is the gynae or eventually with the pediatrician, whether it's the dietitian or the lactation consultant. You should never be afraid to ask questions. So ask all of the questions, get the good answers. Don't just rely on Dr. Google. Make sure that you're finding about specifically you, rather than what is the general public's point of view, or what is one specific mother's point of view in a blog, for example. So it should be very specific advice targeted towards you because your doctor knows you. And so that's the source of information that is preferred.
Yeah, I agree with Dr. Chua as well. So everything should be individualized. What you're going through your pregnancy might not be what some other mummy has gone through. And I think every pregnancy is going to be different, even for your first or your second or your third pregnancy. They're all going to be different. So with regard to food, I think the main takeaway is that, don't be too stressed out about it. I think there are other things to be stressed out about. But of course, we want the safest food for our baby as well. So choose foods that are fully cooked, choose foods that, are prepared well. And also with regards to making sure that you have the right nutrition, you don't have to, You don't have to choose all organic foods. You don't have to choose the most expensive foods. Your basic fruit and vegetables, your proteins and your carbohydrates, they can be store-bought, that's fine. But as long as the quantities are there, the right amounts are there, then that's completely okay. Yeah.
So we're very nearly at the end of our live event now, and I'd just like to say a big thank you to Mount Alvernia for organising the session, to Abbott Nutrition for sponsoring, to A Clinic for Women for their involvement, and to Jacqueline and the Nutrition and Dietetics Department for their input, and to both our speakers for answering the questions so expertly and clearly, and I think just providing a really reassuring session for mummies and daddies to be, and helping them embark safely and in a reassuring way on their journey, their exciting journey to being parents. So I think that's it. It's time for our session to end. So we wish you all a great rest of the day, and lots of fun ahead with your little ones. We can see some of them behind Dr. Chua there.
A lot of them have grown up.
Thank you, everyone.
Thank you, Bridget.
You're welcome.